If a baby was bothered by light, seemed to be upset with light in the room, and a little photophobia, what were your concerns about?
Well, if it's a baby, first of all, it's very hard to distinguish what is bothering the child. He's not going to tell you, my eyes bother me, the light bothers me. But if the child is able to communicate with you and tell you that my eyes hurt, the light bothers me, one condition that it could be is congenital glaucoma. Glaucoma does occur in infants and young children, and it will typically cause a photophobia or a light sensitivity. The majority of kids who have light sensitivity are not glaucoma patients, though. They usually have an aversion. Some light-skinned children can have an aversion to light simply because they're light-skinned and they have probably more glare. Their irises might be blue, more light can get in. Some children who are perfectly normal have an aversion to light, and it might not be anything like glaucoma. So as a parent, you have to distinguish what's important and what's not. If a child has glaucoma and light sensitivity, usually you'll notice that he's tearing a lot. You'll notice that his eyes are getting a little red. Possibly the corneas are getting a little steamy appearing. They look kind of clouded a little bit, and his eyes could appear very large. So if you have a child who fits that description, you might have a child with glaucoma. Most people who have an aversion don't have all those problems. You could also have a light sensitivity that comes on suddenly because you have a foreign body in your eye. Okay? Even very minor things can cause a child to have light sensitivity. Conjunctivitis. An iritis, which is an inflammation inside the eye, can cause a light sensitivity because the actual cilia, which is part of the iris, it goes into spasm because of white blood cells when the light hits it. Those children will also have a light sensitivity. Only a qualified ophthalmologist or pediatric ophthalmologist can determine what the cause of your child's light sensitivity is. And if your child persists to have these problems, he should obviously see somebody who can determine what the cause is.
If a child had a high fever and photophobia, sometimes it's a very serious infection?
Yeah, it could be. I mean, you know, there are problems such as, I mean, one I could tell you about is iritis is caused by a lot of different problems, first of all. And iritis can be caused by any condition which can cause significant inflammation can cause an iritis. For instance, rheumatoid arthritis. That doesn't typically give you a high fever, but it certainly is one of the most common causes of an iritis.